Bismillahirrahmanirrahim. Dear students, welcome you all to the Industrial Pharmacy theory class. Today is our lecture number 11th, entitled Ophthalmic Ointments. The title of the today's lecture is Ophthalmic Ointment. The main objectives of this lecture is to learn about the ointments, including the ophthalmic preparation and ophthalmic ointments, formulation of ophthalmic ointments, organoleptic inspections of ophthalmic ointments, and packaging of ophthalmic ointments. Dear students, after the completion of this lecture, you will be learn about the ophthalmic ointment, including the following topics that I have told you earlier. That what is ophthalmic preparation and ophthalmic ointments, and how we will formulate the ophthalmic ointments, what are the formulation ingredients of ophthalmic ointment, and how we will inspect the ophthalmic ointment, mostly by using the organoleptic inspection or evaluation. The ophthalmic ointments are inspected rather than the other testing procedure, which are also mandatory for the any dosage form, including the assay or percent content, weight uniformity, and the bottle or in the collapsible tubes. Regarding the ophthalmic ointment and several other parameters like the viscosity, and finally the packaging of ophthalmic ointment. You will be able to learn about these topics regarding the ophthalmic ointment. First of all, we will discuss the ophthalmic preparation. That what is ophthalmic preparation? As the name indicates, these are specialized dosage forms designed to be instilled either onto the external surface of the eye, that is topically used, or administered inside the eye, that is termed as intraocular. It means that the dosage form that is designed for either the external application or topical application, or for the administration inside the eye, that is intraocular administration, are termed as ophthalmic preparation. In simple word, we can say that ophthalmic preparation are those dosage forms which are designed to be administered for ophthalmic purposes or eye. There are different ophthalmic dosage forms, but the most commonly employed ophthalmic dosage form include the solutions. We can observe in the market most of the dosage form for the ophthalmic use solution form, either the suspension forms and ointments. These are the most commonly employed ophthalmic dosage forms. There are several other dosage forms, but these are the most commonly employed or commonly used ophthalmic dosage forms. General safety consideration for ophthalmic preparation. That what will be the consideration for the safety of the ophthalmic preparation. There are different ophthalmic preparations manufactured in the pharmaceutical industry. That I have told you the most commonly employed are including the solutions, suspensions, and ointment. But there are certain considerations which are termed as general safety consideration regarding these ophthalmic preparations. These include the sterility. The product should be sterile, it should be free from the microbial contamination, because these dosage forms are administered either topically or inside the eye. And as you know that eye is the sensitive part of the body, and it should be assured sterility. If the products are not sterile, then they cause contamination and cause different other consequences by using the products which are not sterile. We're calling from the first lecture regarding the sterile product, in which I have told you that what is sterile products and what is parenteral product, and I have told you that ophthalmic preparations, whatever, these are topically used, or these are used for the intraocular or for the injectable purposes through the injection that they are delivered. And the irrigation solution, I have told you about the irrigation solution. This should meet the criteria of the sterility, and it should be prepared under the conditions that is used for the parenteral products as well. It is very much essential for the ophthalmic preparation that should pass sterility test. And how sterility test is done and how it is performed in the pharmaceutical industry in the microbiological section or microbiology section. It should be ensured prior to the final packing and after the packing that the products are sterile. The second consideration, we must consider, it is the clarity. There should be no fine particles, and the appearance should be, consistency should be uniform in the ophthalmic preparation. And the fourth parameter, it should be fine important as well, like the first two, that is the ocular toxicity and irritation. The product should be not causing the ocular toxicity and irritation. It should be non-irritating and non-toxic to the eye. To cause irritation, definitely the particle size may be, or there may be crystal growth in the formulation as well. And the last one, that is preservation. There should be proper addition of the suitable preservative to avoid the contamination, the microbial growth, the fungal or bacterial growth, and the ophthalmic preparation. Ophthalmic preparation that we have discussed in the previous, that is a broad terminology that is not only used for the ophthalmic ointments, but it is also applicable for the other dosage forms that is used in the eye, either the topical use or the intraocular use or any other part of the eye it is injected. Overall, we will term as ophthalmic preparation. Now let's consider the topic that is ophthalmic ointment. That is one of the ophthalmic preparations, and these are sterile, should be free from the viable microorganism, and should be homogeneous. And semi-solid preparation, as you know that ointment is a semi-solid preparation, that I have told you in the semi-solid dosage form about the semi-solid preparation, including the paste as well. In case of the ophthalmic ointment, it should be free from the viable microorganism, should be sterile, should be homogeneous, and semi-solid preparation or dosage form that is intended for application to the conjunctiva or the eyelid. You can see product on the screen that is manufactured by the GlaxoSmithKline, and you can see that the dosage form, trademark or marketed name is Cortispurine. That is also mentioned here. That is eye ointment, and the third line of the packing you can see in bracket sterile is written, as I have told you in the definition, that it should be sterile, and also the quantity and this tube, that is the collapsible tubes, that is mentioned 3 gram. There are different advantages of the ophthalmic ointments, but the prime advantages of the ophthalmic ointments include ointment to offer the advantages of longer contact time. They provide the longer contact time to the formulation after the application of the ointment to the eye. If we apply ointment on the eye, it decomposes into small drops, and these small drops stay for a longer time period in conjunctival sac, thus increasing drug bioavailability. Not only the contact time is longer, but also the bioavailability of the drug is enhanced using the ophthalmic ointment. The second advantage of the ophthalmic ointments include the improved or enhanced stability of the drug. If you provide the drug in the form of the ophthalmic ointment, the drug stability is improved in this test. These are the two main advantages of the ophthalmic ointment. Besides the advantages, there are certain disadvantages of using ophthalmic ointments. Ophthalmic ointments disadvantages include, although they are well tolerated and safe, they cause, among other things, although they are safe and well tolerated, but beside that, well toleration and safety, there are certain disadvantages including the blurred of vision, blurring of vision, and sometimes have irritating effects when they are applied in the eye, because of which they are mainly applied like night time. At bedtime they are applied because they cause blurring of vision. The vision is blurred due to application of the ophthalmic ointments, and sometimes they cause irritation to the eye. That's why it is recommended to apply the ophthalmic ointment at night time rather than at daytime. If you use at daytime, and then the disadvantage, that is the blurring of vision, will occur. You cannot see if you are walking, if you have some work and go outside, and then you will be unable to perform your activities smoothly. To avoid this problem of the blurring of vision and irritation effect, after using the ophthalmic ointments, it is recommended, if we use this at bedtime or night time before going to sleep, if we take the dose administered inside the eye, then it will be the blurring of vision, and the other will be not happen. The second main disadvantage is the sticking of eyelids. You have experience if you use ophthalmic ointments, there are sticking of eyelids by using the ophthalmic ointments. So these are the certain disadvantages that I have told you: the blurring of vision, irritating effects, and sticking of the eyelid. Now let's discuss the formulation of ophthalmic ointments. They are usually prepared from the non-aqueous bases. The non-aqueous bases example include soft paraffin, liquid paraffin, and wool fat. Mostly these are prepared from the non-aqueous bases. The ointment base must be not irritating to the eye. It is the primary criteria for the ointments that I have told you, that irritation should be avoided, and the previous slide that I have told you that what are the general safety conditions. And the third, after the clarity, you can see the ocular toxicity and irritation in the ophthalmic preparation. But here in the ophthalmic preparation, one of the ophthalmic preparation, that is ophthalmic ointment, and the selection of the ointment base should be based on the non-irritancy to the eye. If it is irritant to the eye, it should be substituted with the other suitable base that is selected on the basis of the non-irritancy to the eye. The base selected for the preparation of the ophthalmic ointments must melt near to the body temperature in order to permit the diffusion of the drug through the lacrimal secretion of the eye. If it is not diffused through the lacrimal secretion of the eye, then there will be a problem in the bioavailability of the drug to the eye. Ophthalmic ointments contain suitable additives, for example antimicrobial agents to avoid the contamination, antioxidants should be added, and as well as stabilizing agents are added in the ophthalmic ointments. Remember that all the ingredients, that is additives, except from the active pharmaceutical ingredient, should be selected on the basis of the compatibility with the active pharmaceutical ingredient as well as the other ingredients in the formulation. We have used a terminology that is lacrimal secretion, that the base must melt near to the body temperature, and after melting the base, it permits the diffusion of the drug through the lacrimal secretion of the eye. Lacrimal fluid or lacrimal secretion is secreted from glands and located on the surface of the eye, and it is responsible for the diffusion of the base as well as the drug. Organoleptic infection of ophthalmic ointments after the formulation or the preparation with the basic ingredients or the base and the other additives are added on the basis of the compatibility and efficacy. Evidence of physical instability in the ophthalmic ointments is demonstrated by using the following consideration. The first one is a noticeable change in consistency, such as excessive bleeding or formation of agglomerates or gelatinous in the formulation is occurred, or a noticeable change in consistency occurred, like the excessive bleeding. Bleeding here means separation of excessive amounts of liquid. The liquid that is used in the formulation is separated from the formulation. Definitely it will change the consistency, that is the uniformity or the physical appearance of the formulation. The second evidence is the physical instability. If it happens and the formulation resulted in the discoloration of the ophthalmic ointments, they change the color of the ophthalmic ointments, is the indication of the physical instability. The third one is crystal growth. The crystal growth occur in the formulation. The particle size is no more controlled after the growth of the crystal in the formulation, and that leads to the physical instability of the formulation. Another physical instability problem that is evidenced by shrinkaging of the formulation due to evaporation of water. The water or the aqueous part in the formulation is evaporated, and the products, that is ophthalmic ointments, become shrink. That is the evidence of the physical instability in the ophthalmic ointments. The last one is evidence of microbial growth. Microbial growth also alter the stability and physical instability happen, and that is due to the microbial contamination. A suitable preservative is not added. Taking the dose during the taking dose, proper precautions and certain operating procedures are not followed during the administration of the ophthalmic ointments. Uniform consistency of ophthalmic ointment. It is mandatory for the ophthalmic ointment. It should be of uniform consistency, and it can be checked by taking a sample of the ophthalmic ointments formulated or prepared and then rubbed on the back of the hand. If no solid component is noticed, it means that the ophthalmic ointment containing uniform consistency in the entire formulation. If there is solid component that is noticed or experienced on the back of the hand after the application of ophthalmic ointment, it means that the uniform consistency is not experienced. Finally, we will discuss the packaging of ophthalmic ointments. Packaging is one of the important. Before going to the packaging of ophthalmic ointments are prepared, formulated, they are tested for different parameters or the physical and chemical parameters, like the weight variation should be done for the tubes as well as the physical evidences. Instability problem should be checked properly before going to the packaging, and after the packaging their weight, their texture and their application should be also checked, and process quality control tests are also done for the formulation during the packaging. For example, the weight variation are performed during the packaging and the final tubes. Proper filling machines are there which not only control the weight but also automatic machines are available for the proper labeling and sealing of the tubes as well. Ophthalmic ointments are normally applied small. Remember that it should be small, sterilized, free from the viable microorganism. Collapsible tubes, just like we use an ordinary live and a toothpaste. Here you know that toothpaste containing tubes are collapsible, and these are not small. Larger amount is there as compared to the ophthalmic ointments, and fitted with a tamper evident applicator. The containers or the nozzle of the tubes are shaped or designed so that the ointment can be applied as required without contaminating what remains in the tube. The collapsible tubes or any other container that is used for the packaging of ophthalmic ointments are properly shaped or designed in such manner that we can take or apply the dose or the material from the ointment tubes, but there is no chances of contamination what is inside the tube. The content of such container or tube is limited to not more than 5 grams of the preparation, In the previous I have told you about the tubes that is shown to you people, that is corticosporine, and corticosporine is packed in the 3 gram tube you can see on the screen. But remember that normally and usually it should not exceed 5 gram of the preparation. Ophthalmic ointment content should not be more than 5 gram, but usually small collapsible 10 tubes at holding the product, that is 3.5 gram. But I have told you in the previous lectures that most of the ophthalmic ointments are packed in the tubes, that is collapsible, small collapsible tube, and amount is 3.5 gram in the usual cases. And remember that the content should not exceed 5 gram of the product. Aluminium tubes may have been used for the packaging of ophthalmic ointments because of their low cost and as an alternative of tin. Aluminium tubes are used because of these reasons. It is one of the substitute of the tin tubes, and the second priority that is given to the aluminium tube is due to their low cost as compared to the other packaging. References you can see, that is Remington, The Science and Practice of Pharmacy, 21st edition, page 56 to 57. Blackman, L. Lieberman, The Theory and Practice of Industrial Pharmacy, 3rd edition, pages 639 to 661. Banker, G.H. The Modern Pharmaceutics, 4th edition, pages 425 to 431. And Ophthalmic Drug Dosage Form, Characterization and Research Method, The Scientific World Journal, Hyundai Publishing Corporation, pages 1 to 14. Remember that there is a 4th one you can consult, that is the review paper, and the review paper entitled Characterization, Ophthalmic Drug Dosage Form, Characterization and Ophthalmic Method. This is the title of the paper, that is a review paper you can consult, and that is published in the Scientific World Journal, and that is published in the Hyundai Publishing Corporation. Now review over this lecture, today lecture, in which we have studied the ophthalmic preparations. That what is ophthalmic preparation? First I have told you about the ophthalmic preparations, and that is used for the eye, either the external surface of the eye or it may be administered inside the eye. For the external surface of the eye, that is used or instilled, that is termed as topical preparation, and that is administered inside the eye, that is intraocular one. And I have told you about the several ophthalmic dosage forms, examples including the solutions, suspension and ointments. After that, I have discussed in detail the general safety consideration for ophthalmic preparation. Any ophthalmic preparation should be considered for the sterility, should be free from the viable microorganism, it should be clarity, If we check the clarity test, it should be clear. Ocular toxicity and irritation should be checked for the ophthalmic preparation. If it causes the toxicity and irritation, definitely it should be avoided. And it should be preserved. If it is not preserved, proper